Hi there. My name is Elena, and I just wanted to take a quick second to thank you for reviewing my submission. And hopefully, I'll see you guys in 2026. Bulldogs, hopefully. Let me go ahead and get started. What interests me the most about becoming a sonographer, what interests me the most about being a sonographer is being involved in the process to aid people. I am a natural caregiver and I feel a deep conviction to work in the healthcare field. Upon doing much research on many positions, the ultrasound diagnostic suited me the best, and I felt that it was a great fit. I can be a part of saving and making a difference in people's lives directly. And I'm also a lover of learning. And I know this field provides the opportunity of continuous learning. And so that really fits me perfectly. As far as my experience in the medical field, I I had experience in the dental field. I was a dental assistant for around 7 years. I worked directly with the dentist and directly with patients, assisting with all procedures like uh, filling composites, root canals, crowns, oral surgery with and without sedation, implants, dentures, patient aftercare after they had their procedure. I would explain how to take care of themselves, sanitizing and resetting and prepping the rooms, charting and creating notes, and taking x-rays, impressions, and creating stone models. I did a lot more, but that was the basic stuff. As far as my experience that I have working with sick and dying patients, my patient was my mother. She actually passed away from cirrhosis of the liver, and around that time, I aided in caring for her daily hygiene and other needs, such as giving her proper food and um, whatever food that her body could break down because she wasn't able to digest certain proteins. And the reason why I spend my life working, reason why I want to spend my life working with dying patients is to make the difference in their lives. And I want to help them get healthier. And if that's not possible, I want to know that I can at least assist them with making them comfortable while they're still here. My philosophy on patient care aligns with a biblical scripture, and a general golden rule: do unto others as you would have them do unto you. And it's pretty that simple. When people are sick and dying, they are in a vulnerable state. And the human thing to do is have empathy and have understanding that they're going to be in they're having going through an extremely difficult time. Everyone has different reactions to hardships, and just knowing that their reactions are based on what they're going through, and it's important to keep that in mind. And everyone has been there, and everyone deserves to be cared for in that state, and there's no exceptions. Let's see, my understanding of the diagnostic medical sonography includes several clinical specialty areas, including general, vascular, and cardiac sonography. What the three modalities have in common is using ultrasound technology to create images inside the body and having a strong knowledge of anatomy, physiology, and ultrasound physics, while also maintaining excellent technical skills and attention to detail. They're all responsible for obtaining accurate images and recognizing abnormalities and communicating findings to physicians so that the appropriate diagnosis and treatment plans can be made for the patients. The role of sonographers differ depending on the area of focus. Cardiac sonographers work closely with the cardiologist to assess heart function. Vascular sonographers focus on circulation and blood flow. And general sonographers perform a broader range of imaging studies across multiple organ systems. So more specifically, general sonography focuses on imaging organs such as the liver, kidneys, gallbladders, pancreas, thyroid, and reproductive organs. They also perform a wider range of examinations, including abdominal, pelvic, and obstetric imaging. And vascular sonography focuses on evaluating the blood flow through the arteries and veins. Vascular sonographers assess circulation throughout the body and help detect conditions such as blood clots, narrowed arteries, or other vascular abnormalities. Cardiac sonography focuses specifically on imaging of the heart. So they evaluate the heart structure, valve function, and blood flow through the chambers of the heart to help diagnose cardiovascular disease. The specialty I chose to pursue is cardiac sonography. I am particularly drawn to the complexity of the heart. I think it is fascinating. One of my innate convictions is to make a difference in helping people in healthcare. Heart disease is the leading cause of death in the US, and the importance of the heart is vital for life. So what better way to make a difference in saving lives than working with the heart? Cardiac sonographers require strong technical skills, critical thinking, and attention to detail, which makes the field both challenging and rewarding. The opportunity to contribute to diagnosing and monitoring heart conditions while helping improve patients' outcomes is what makes the specialty especially meaningful to me. Regarding the challenges that come along with becoming a sonographer, through my own research, I have followed practicing sonographers on YouTube. Giselle is my favorite, which has helped me see what the job actually looks like on a day-to-day. From what I've learned, the role requires attention to detail. It's a big one. Physical stamina, emotional strength at times, and the ability to stay focused while working with patients who may be nervous, in pain, or dealing with difficult diagnoses. I believe the way I will overcome those challenges is by just remembering that my patient's need for care is far greater than my own discomfort. Many patients may be anxious, in pain, or facing difficult situations, and they deserve to feel supported and cared for during those moments. And keeping that perspective will help me stay focused on providing the best care possible. I'll always look for ways to improve how I care for my patients so they feel respected, comfortable, and supported through their patient care experience with me. Thank you for taking the time. I appreciate you, and I hope to see you very soon. Bye.